Good day, respondent. First and foremost, I would like to thank you for joining our survey in hopes of improving the research. In this slide, we can see that this is the standard way of doing record keeping in institutional clinics. And these are the problems that we have found regarding on this topic. First, it compromises data security. Secondly, physical documents and conventional file systems are a hassle to maintain and it's an inefficiency of space. And lastly, separation of systems will result into a slower and cumbersome way of passing around data. This is where we come in, introducing SAMS, a smarter and faster way of record keeping digitally. With SAMS, it is equipped with keeping health records, physician order entry, and clinical decision support system. And not to mention, it's all digital. Now, what is SAMS? First and foremost, the definition of SAMS is Smart Accessible Medical System. Now, with SAMS, is an all-in-one record-keeping system intended to be used by institutional clinics. So this is the significance of the SAMS application. And as you can see here, this is the standard way of record keeping. As to your far left is the individual health record form used to record patients. And at the very middle is the prescription form. Now, what if it will be converted to a digital form? So the next part of the presentation is the demonstration of the user physician. And this is what the physician can do inside the application. So first is they are able to create a medical record for the patient, create notes, create a patient's present illness, create a prescription, use the CDSS utilities, naming EDP and SDP or evaluation disease predictor and the symptom disease predictor. Search patient by ID and name or name, and search the diagnosis, sort the diagnosis by date, and of course, navigate through the application. So with this, let's log in as a physician. So this is what the physician can see for the inside the application. So they can see electronic health records and your notes. So let's imagine a scenario that we're going to create a patient's medical record inside the application. So what we're going to do is click on the plus button that is located at the app bar, and we're going to register the patient. And what we are going to do, first and foremost, there are three sections, naming general information, medical information, and person to be notified in case of emergency. So we're going to insert the details of the patient. Nelison Justin V. They can also see that na ay civil status si patient. Pwede siya mopili either single, married, divorced, separated, or widowed. By default, kaning single ang gipili. But of course, pwede siya makapili aning married or divorced. And makaselect na siyang gender. And maka-input to siyang birth date. Let's say they were born on February 15, 2001. And makaselect ta sa unsay department sa patient. And with this, pwede sa ta makabutang sa year level and their student number. Pwede sa ta makabutang sa address sa patient. Oops, Lipata. Millanilla, Cebu. And their height, 165. And their weight, 20. By these two inputs, ato na siya himon as optional kay tungod wala ta kibaw if ang patient naa ba siya active email or contact number. Let's just say na ay contact number si patient. So, atong butyan ay ang contact number. And by the medical information section, naatay drop-down selection wherein pwede ta maka-select sa na ba siya asthma, hypertension, cancer. With these sections or categories by past disease, family history, allergy type, o illnesses. So first, ato sa ni i-fill up si select past disease, and let's just say na hypertension and thyroid problems si patient. And if we're going to change our mind na wala day thyroid problems si patient, so ato ning pisilito ning X para matangtang siya. And let's just say nga napindot na to si NA and at the same time napindot na to si cancer. Nagpislit na to submit na magawas na rin nga, are you sure? It seems that you've selected NA and selected an illness. So we're going to correct that. And sa tinuod day, wala day cancer si patient. Pero NA day ang tubag aning. Now for the allergy type, let's say nga wala di ay gilista diri ang iyang allergy. So mabutang tag other and manually insert the allergy. So yung ta pollen or na siya allergy of insects. Pollen, insects. In the last section of registering the patient is the emergency contact information and the contact number of the person to be notified. And lastly is the current address. What we can do, instead of retyping it all again, we can just press this button, same address as above, to copy paste it inside this current address. And then by clicking on submit, the patient is registered in the application. Now let's just say patient Justin has a complaint. What the physician can do is they can insert a diagnosis for this patient. Let's say that the patient has their complaint is dry cough, and the findings is the patient is experiencing pain in the throat. And to find out they have COVID. The patient is diagnosed with COVID. As a disclaimer, this what I entered is not somewhat an accurate presentation, but this is just dummy data to represent or to do a demo on the application. And by the last part of the present illness form is the creation of prescription. And okay, let's do a demo for the creation of prescription. So let's say this is the medication needed for that type of diagnosis. Take this 3 times a day after meal for 1 week. So 21. So it is listed in here. You can also edit it and delete it. The patient needs to intake this medication. And by clicking on the next part, we have the last section wherein we have a summary of what we've inserted in the present illness form. So we have the summary for complaint, findings, illness, and diagnosis, treatment, and we can also see the prescription. So by clicking on submit, it is reflected in the history of present illness. Now let's just say that we want to use the evaluation disease predictor in this scenario if we want to diagnose this patient again. So with this, so the evaluation disease predictor has the following questions. Does the patient have fever? Does the patient have cough? Does the patient have fatigue? Is the patient experiencing difficulty in breathing? What is the blood pressure of the patient? And what is the cholesterol level of the patient? So with these common questions, what we can do is either select yes or no, or low, normal, high in the blood pressure or in the cholesterol level of the patient. So let's just say these are the values that we can insert. And if we're going to submit this, we're going to have a prediction of the illness or the result that the patient has. So as we can see here, the patient has 30% a confidence score of 34% of asthma and a confidence score of 21 in migraine and 16 of osteoporosis. So let's just say this is the correct one, the asthma. So we're going to use this. And so after creating the diagnosis of using the EDP or evaluation disease predictor, we have the result and summary of the diagnosis. Let's just say we're going to use the SDP part of the application. So we're going to diagnose the patient and use the SDP. And what we need to do is insert at least three symptoms. We're going the doctor has to ask the patient what they're currently experiencing. So let's say the patient is experiencing joint pain, the patient is experiencing stomach pain, and they also have acidity. So if we're going to analyze this, the symptom disease predictor has predicted an allergy, a suspected disease of an allergy with a confidence score of 99.97. So if they say that this is not the correct one, we're going to analyze again. And let's say we have a skin rash and stomach pain and also itching. We're going to analyze this again. The suspected disease with a confidence score of 97.48, they may have a fungal infection. So if the physician is confident with this, they can use this for the present illness form. So after clicking on submit, we have created a demonstration on using the symptom disease predictor. And what the user can do, they can they can also search other patients by name. So let's say we're going to search the patient of Mark, and we can see the patient's details also here, or they will be redirected to Mark's medical record. Let's just say we can also search for the specific diagnosis. And what the user can also do is sort the diagnosis by date. So this is sort by recency. So this is the first recorded diagnosis. By default, the recent diagnosis is listed at the very top of the list. And by navigation, the physician is able to click on the dashboard, and they can see and they can be redirected to the electronic health record. And the next part of the presentation is the creation of notes. So with this, let's just say at 9 a.m. with Doc Pagula. So by creating notes, they can also have a to-do and also edit their specified notes. Let's just say that physicians has a to-do and they've already completed their to-do. So it is reflected on the completed tab. And if they change their mind, they can just also click on the check box, and it is reflected back to the to-do. So by this, that is the demo part of the physician. Thank you for watching.